Assalamu alaikum. My name is Esraa Mahdi. I am studying in Esraa University for Women. In second stage, I will explain about pediatric pelvis X-ray examination. The aim of report: introduction, the patient position, AB view, frog leg lateral view, and risk. Anyone who hear about this reporter will be asked two questions. What are X-ray and how do they work? Why is pelvis exam done? In general, medical image help in the development and success of the diagnosis and this access to the required treatment, whether in the children or adult. X-ray are an examination in which electromagnetic radiation should by a special radiation device penetrate the tissue of the body, hitting a plate placed behind the body, forming an image of the body, a part that penetrates it. Pelvis X-ray can help find the causes of symptoms such as pain, swelling, or deformment in the air of the pelvis, hip, or upper leg, and can reveal a broken bone after injury. Performing pelvis radiography on pediatric patient can be for number of indications: trauma, full development displays of the hip, transient synovity, Bright's disease, sleeped upper femoral epiphysis. This picture shows the pelvis skeleton. Now we explain the position pediatric pelvis is to position AB view and lateral view. Pediatric pelvis AB view is routine view for pediatric patient to examine the hip joint, proximal femoral, iliac crest, and pelvis region. Patient position: patient is supine with no rotation of pelvis. Patient leg internally rotate. Patient is placed on top of the detector. Technical factor: anterior posterior projection, centering point, the midpoint of the anterior superior iliac spine, and pubic symphysis. Collimation: laterally to skin margin, superiorly to above iliac crest, inferiorly to the proximal third of the femur. Detector size will vary depending on patient size. Exposure: 63 to 70 kVb and 2 to 5 mass. SID 100 cm. Grid: if the patient thickness is above 10 cm, use a grid is advisable. Image technical evaluation. Critical for pelvis remain the same as for adult pelvis radiography. Entire of the bone pelvis is imaged from the iliac crest to the proximal third of the femur. No rotation equal obtrude femoral equal concavity of the iliac wing. Pediatric hip from frog leg lateral view. The frog leg lateral view is a special radiography of pelvis. Evaluate the hip. Some departments will perform this routinely instead of the AB pelvis view to reduce exposure and maintain high diagnosis accuracy. Patient position: the patient is supine with no rotation of the pelvis. The effective limb flexed at the knee approximately 30 to 40 and the hip abducted 45. This can be lateral. If on lateral, the heel of the effective limb should rest against the medial aspect of the contralateral knee. The technical factor is similar to AB position. Image technical evaluation. The entire of the bone pelvis is imaged from superiorly of the iliac crest to the proximal shaft of the femur. The obtrude forming appear equal. The iliac wing have equal concavity, a greater trochanter of the proximal femur and in profile. Finally, the risk when the patient do the X-ray exam. Damage to X-ray on children, exposure to large dose of ray in a short time may lead to visible burn on the skin. But the damage of X-ray children, the most dangerous, lie in the incidence of cancers, tumors, as the children cell are an active star of growth and division, and this may affect radiation on the genetic material present in cell, and this transformation into cancer cell. And also, after there is no enough and confirmed evidence of proof the valuability of this theory. Exposure to large amount of radiation may increase the incidence of cancer, especially in children.